New Mexico is up to well over 2,000 cases of COVID-19. Aside from tribal outbreaks, cases are clustered in the most heavily populated parts of our state, as you might imagine. That makes sense, but it's created a unique problem for rural hospitals, which have shuttered their elective surgery operations, preparing for a surge in COVID-19 cases. I've got a group of three line regulars joining me at our virtual line table today. We welcome Diane Snyder, a former state senator. Tom Garrity is with us of the Garrity Group PR. We've also got attorney Sophie Martin. She's a regular with us. And Sophie, let me start with you. There's a paradox here. They hope social isolation measures work, but if they do, the capacity and preparation and stand down of money-making surgical procedures will seem unnecessary. It's a very interesting dilemma. How do they get around this kind of thing?
Well, I mean, I think there isn't at this point a great plan for getting around it because, as you just articulated, there's a real tension between the larger mission of the hospital, which is the health and safety of the community, and the health of the hospital, which is impacted by a number of things right now. You know, not just the loss of elective surgeries, but also the community saying, like, maybe I don't need to go in to get checked out. I mean, we see nationally that there's an uptick in cardiac incidents that are not being treated quickly because individuals are like, I'm going to ride this out instead of risking going in. So, it's a very complex situation, as it is for so many of us and so many businesses in this time of COVID-19. I don't know that we always think of hospitals as businesses, but they do need to be able to pay their workers. They need to be able to buy supplies. All of those things can't just not happen.
Absolutely. Tom, I think we're all getting a lesson here on the economics of a hospital. I mean, I've talked to friends who actually believe hospitals are just swimming with money, that they get all the money they could ever need. And now we're getting this reporting that when you have a 40 to 60% drop in income, it has profound impacts on staff and everything else. Again, same question. Where do these folks turn if they're burning this kind of cash, just trying to stay afloat?
Well, hospitals they're very complex entities. I mean, when you look at just the staff that they need to be able to retain and attract, when you look at all of the equipment and the certifications, not to mention the inventories and stuff, the solution for rural healthcare really is to find a way to get back to normal as quickly as possible, because in a lot of these communities, whether it's Gila Regional in Silver City or in Lovington, these healthcare or these hospitals are really the nerve center for the community, and it's really not just a nerve center because everybody relies on the success of it, but also because the employment side of it as well. It generates a lot of revenue into different communities. But yeah, when you mentioned the drop of 40 to 60% of revenue, and that represents about $200 million a month, according to the New Mexico Hospital Association, it's easy to get lost thinking, oh my gosh, these guys are cash rich. Well, no, it's a very expensive, very complex industry.
Diane, Searchlight New Mexico published an interesting story that pointed out that press and VA hospitals here in Albuquerque tossed vital but just recently expired personal protective equipment ahead of the inspections earlier this year. And I'm wondering if is this just an indication of how unprepared the health system is when you see a story like that?
No, Gene, it isn't. Because they were following their regulations and their laws. They were doing what they were supposed to do. We didn't know it at that time. We knew the pandemic was coming, but nobody expected it to be what it has become. So when you're going to be inspected, you can be closed down for minor infractions like that. And so they were doing what they thought was the right thing to do to maintain their certification and to be able to continue to provide services to their patients. Unfortunately, we then faced the problem of, do we have enough supplies? Do we have enough masks? Do we have enough ventilators? All of these kinds of things that are needed. So it wasn't that they were being frivolous. They were following their regulations and what they were supposed to do. I wish we had a better idea, both nationally and at our state, of what was coming. So they could have taken the risk and just said, I'm not going to do it. Another thing, the regulators should have said, we don't know what's coming. We're going to cut you some slack for 6 months.
Right.
Then we come back and check you and ding you if you're doing something wrong. So
That makes sense.
That's what they should have done.
And I appreciate your point. Looking back, it's easy for us to sort of, post quarterback or post game, analysis. It's very easy to kind of figure these things out. But so let me go back to something you mentioned at the top of this, which is interesting. And this was actually mentioned in one of the quotes Colleen Heald had in a terrific piece in the Albuquerque Journal about the stresses on rural healthcare, is that folks are not showing up, as you mentioned, for other things, but the folks who are showing up in rural hospitals are showing stress-related problems from this pandemic and the shutdown, the uncertainty, the being out of work, all that kind of thing. And Sophie, there's like a cruel irony here when you think about who's actually coming in and who's not coming into hospitals in rural parts of our state right now.
That's right. And I think I imagine that everybody who's watching this is experiencing some level of extraordinary stress,
Right.
Unexpected, unusual stress as a result of the pandemic. Just talking with colleagues in my industry, we talk about how we're doing, for those of us who are fortunate to still be able to work, to be working, we're doing our jobs, and then there's like an additional 50 to 75% of just planning for the multiple futures that we can conceive of, keeping our families safe, keeping our extended families safe, what the implications are for our jobs. I posted on Facebook not that long ago that I felt like I could never shut down. And it's true. I spend my day worrying about what impact COVID-19 is going to have on my employees and the programs that we run. And then I go home and I read the news and I worry more about what impact COVID-19 is going to have on my family, the people in our community, who are all so terribly impacted. And then again, what's going to happen with my work. So it's like you cannot actually ever escape it if you're not working.
That's right.
I hear from friends that they're spending phenomenal amounts of time trying to get unemployment, trying to get assistance. And so they spend all their time also worrying about, when will businesses reopen? Where can I find a job? Will the unemployment insurance come through for me? How is this going to work? It's a phenomenal emotional load that everybody is bearing right now.